Okay, thank you again for all of our presenters for sharing all that valuable information. And we'll now go into the live Q&A portion. So we have some time for some questions. And again, as we mentioned earlier, that we do ask that if you have a specific question for a specific presenter, to please include their name first when writing out your question in the chat. We did see that there were a couple questions in the chat already. We can go to those first. First question was from Tracy. And it looks like the question was for Clay Jones. And the question was, how can we advocate for hospital systems to see standardized drug screens on admissions or for certain admitting diagnoses, such as preterm labor without patient's consent?
About hospitals. So situations in hospitals, it varies widely. And actually, some hospitals actually implement the easily control approach. And but we find, of course, I was surprised to find in this work the last several years that actually labor delivery units in hospitals are one of the most highly stigmatizing places for our moms struggling with NCD. And in fact, a couple of years ago, I spoke with one of the maternal social work directors at one of the major birthing hospitals and asked them this question about, drug testing, expectant moms or new deliveries. And I said, how do you go about this? And I was told, quote, oh, you know who to test. You can tell. And just a very blatant, example of the stigmatization. So one of the things that's really enlightening about the Maricopa Shift Collaborative is that this is our overarching philosophy. We've trained about 3,000 different providers from all different types of work in the county on this and dispelled the myths and facts and some clear information about that really is really helpful for that. But we have a long way to go. Maricopa County is the third largest public health jurisdiction in the entire country. So it sounds like training 3,000 people is a lot, but it's just a drop in the bucket from the work we have ahead of us.
Okay, thank you, Clay. There's one additional question from Tracy as well, and are there shift type programs in other counties in Arizona?
Yes, so it's called the Shift Collaborative. Maricopa Shift, Yavapai Shift, Coconino, and Canal all have Shift Collaboratives in various stages of development. And we anticipate eventually all 15 counties will have their own Shift Collaborative. This summer, there's a team of us going to Yuma and also Lake Havasu, which is Mojave County, where there is not yet. And one of the goals of those presentations and that work is to start planting seeds in those rural jurisdictions about what it would look like for them to start to develop this collaborative in their area.
Thank you for that, Clay. The question is, are there any plans to coming to...
Yes, thanks for asking if there's plans for Cochise County. Not yet. Like I mentioned, we have 15 counties. We have 4 started. We are a small but mighty army developing this, and it's a long-term process. But eventually, I can't say when that will happen, when all 15 counties will have their respective Shift Collaborative. So we have 4 in the works now, planting seeds in Yuma and Mojave County, and going on from there.
Can pass it over to Katie.
For those great presentations and all of the questions and communication that was going on in the chat. Looked like a really fruitful discussion about how we can do a better job of communicating with decision makers. So it's really the focus of this conference. So I'm glad to see a lot of discussion about that.